Just to begin, give us an
Yes.
overview of who you are and what it is you do.
Yes, so I'm Dr. Susan McDonald. I'm a family physician for the last 30 years. I'm also the Chief Medical Officer for Northern Health. Northern Health is one of the 6 health authorities in British Columbia.
Okay. And so in your opinion then, what would you say are the 3 main challenges facing patient experience?
Well, patient experience, as many other initiatives within the healthcare system, faces challenges, but I think there's significant momentum that has developed over the last few years to really move this forward. Some of the challenges are common to any other change. There are many stakeholders, patients of course, healthcare practitioners, and other individuals who support the healthcare system with respect to working within the hospital in a non-medical capacity, and of course families. So being able to ensure that communication is effectively being transmitted to all the different stakeholders is one challenge. The second, I would say, is capacity. There are many competing priorities for many people. And often people will say, well, how is this going to affect me? Is this something that I should be embracing? I'm so busy doing something else. So capacity, the ability to have enough time to embrace the changes and to be able to incorporate them into everyday life. And I would say the third, there's many challenges, but also many opportunities. The third is to ensure that we do get the right feedback, that we are listening, and that we are using the information that is helping to guide us in an effective way.
Excellent. And then for your particular organization, where would you say you're at in terms of implementing a patient experience model? Are you more towards the planning stage, or have you already fully committed to something and you came to this event to improve upon what you already have?
Yes, very good question. I think Northern Health, as part of its strategic plan, as an organization, has always put significant emphasis on patient-centered care. There's a variability across the region. Northern Health takes up 2/3 of the geography of British Columbia, and many communities are quite, can be remote, some are not. So I would say that we are in the implementation phase. We did just actually win a provincial award for collaborative solutions in British Columbia for our Stop HIV work. And part of the reason behind that was that we engaged the communities as well as First Nation Aboriginal societies, associations, as well as communities in our work. So we put a lot of emphasis on ensuring that those whose care would be affected were involved. Patients were involved. It was a grassroots type of approach.
That's excellent. And so lastly then, what would you say you've gotten out of the conference these past 2 days?
I think the last 2 days have been very helpful to see the ideas that are coming forth from organizations that have been working towards ensuring that patient-centered care is moving forward in their organizations, but also those who are just starting to hear the questions and to learn from each other, but also to be able to teach each other what obstacles might exist, what opportunities, but also to realize that there's always opportunity to move ahead and to improve the quality of care that we provide to our patients and their families.